Welcome. Thank you for being here. Welcome to the Ontario Near September monthly webinar. I see everybody pouring in. Let me take a look who's there. Thank you everyone for logging in and attending our webinar. We'll just wait for a few minutes for other attendees to get here. Maybe 1 minute, and then we will invite our knowledge keeper in to do our spiritual opening. Thank you for being here. Very happy to see people pouring in on Friday morning, early afternoon, on this special day where we begin honoring our Indigenous residential school survivors here in Toronto and across Canada. I hope to see everyone down at Nathan Phillips Square either this afternoon or at some point on the weekend to honor those survivors. So miigwech for that. So we're a couple minutes after our start time now. So maybe I will invite our knowledge keeper, Sue Lemure, to join us. He's at the Institute office. So if they want to turn their camera on over there, and I will introduce myself and welcome all of you. So my name is Ethsi Stewart. I'm using my Clicho name in my language. My English name is Suzanne Stewart. I'm from the Yellowknives Dene First Nation, and I'm a member of the Eagle Clan. And I'm also a full professor at the University of Toronto in the Dalalana School of Public Health, and the director of the Waakebiness Institute for Indigenous Health Research. And I'm also the principal investigator of the Ontario NEAR. So welcome everyone, and I'm going to turn it over to our esteemed traditional knowledge keeper, Sue Lemure, who's going to introduce himself and then open us up in a good way with prayer and medicine. Miigwech, Sue.
Matthew Cho. Well, good afternoon or morning, whatever it is, wherever you are, it's happy hour somewhere, okay? I just started a smudge, so that's what we do for when we have meetings. We start with a smudge and everybody smudges. So I'm just gonna go around the computer and everybody's done. Okay, and I get myself. All right, let's invite our ancestors, our grannies and grandpas in that bit, and anybody else who wants to join. And we'll have a good webinar. Anybody has lots of questions to ask or say or whatever to Ethsi. And I hope everybody has a great day. Miigwech. Pretty short. Short and sweet.
Masi Cho, Sue, thank you. And thank you for doing that. It's really an honor to have you here. And you're welcome to keep your camera on or off during the presentation, Sue. It's up to you. You can decide. But at the end, I'll invite you back to give some comments and to close, if that's okay.
Yeah, no problem.
All right, so I'll just get started with the presentation. Hopefully I can get this working and play from the start. So can everyone see this okay? And just to let everyone know, the meeting's being transcribed and it's being recorded, right, Shanti?
Yes, it's being recorded.
Okay, great. Just to let everyone know here. So if we do have time for when we do have time for questions and comments at the end, then we will still be recording then. So thank you. So I was invited here by the Ontario NEAR to talk about our youth mental health research that we're doing right now in collaboration with local and national Indigenous community partners. So the project that I'm here to actually talk about is this project that we have with Indigenous youth and elders about the impacts of the climate crisis on mental wellness of Indigenous youth. So just to acknowledge myself as a longtime resident and visitor here to Anishinaabe and Haudenosaunee territory. I come from the Yellowknives Dene Nation, so Massey Cho, for having me and hosting me and my family here. And the local community has done a lot to welcome us into the fold here. So I'm very grateful for that, and I want to acknowledge that relationship that I have with the land here and the original peoples of this area. So miigwech. So just a little bit of background. So this is actually a project that's in partnership with another one of the NEARs, with the Northwest Territory NEAR. So those who aren't familiar with the NEAR program of research, 6 years ago, CHR developed a program of research funding to establish 9 Indigenous health, regional health research networks across Canada, loosely one for each sort of province and territorial area. So there's an Atlantic NEAR for all of the Atlantic provinces. There's a Quebec NEAR, Ontario NEAR, Manitoba, and so on down the line. So because I'm from the Northwest Territories, I do have close ties with the community there. So part of this project was really developed because of my ties to my home community, as well as my ongoing relationships with Indigenous community organizations in the Toronto area. So we won't be covering the Northwest Territories NEAR data set, but I will mention it and what they're doing in that aspect of the project. So in Toronto for this project, our research team is partnered with Two-Spirited People of the First Nation, Native Women's Centre of Toronto, and Kids Help Phone. So those are our main community partners who really drive the research and are embedded in every aspect of the project. And I'll explain what that looks like in detail. How did the project start? Well, it actually started in 2021 when an elder from my community, Francois Paulette, so he's the one on the right side of me in the picture, but on the left side of the photo, he's one of our great spiritual and political leaders where I'm from. He phoned me up one day out of nowhere because he has a relationship with my family going way back generations. And he asked me if I would be interested in, he phoned me up via Kimberly Fairman, who is who is the director of the Institute for Circumpolar Health Research. And she's also the lead of the Northwest Territories NEAR. So the Northwest Territories NEAR, Kimberly Fairman and I had already started to work together on different national Indigenous mental health sort of projects and ideas. So when the elder from my community contacted me and said that he wanted me to do this research on looking at the mental health impacts of the climate crisis on our young people, I, immediately, wanted to meet that need that our elder was talking about. And so that's when we brought our elders together. That's Clayton Shirt. He's one of the elders on the Ontario NEAR and the elder in resident at the Waakebiness Institute. And it turns out that they had a spiritual connection through their lodges that dated back to Vern Harper. That's Clayton's father. So there's a lot of spiritual connections that underpin this project and its impacts and successes. So the research that I'm going to share with you actually has 3 phases. It started as the pre-pilot, and that was what Elder Francois Paulette asked us to do, and I'll talk about that. And then as we got to the end of what we now call the pre-pilot, which was actually was a bunch of articles, but it was really about doing plays with the young people and the elders around the mental health impacts of the climate crisis. Then we applied for 2 years of funding from a CHR Catalyst grant. So we kind of call that the pilot. And then we have the full project, which we just found out recently that we were funded for 5 years through a CIHR project grant to really expand the reach of this program of research from Toronto and the Northwest Territories to being scaled up to a national project. So to give like a little bit of background of why our elders wanted us to look at this topic and investigate this is because our First Nations, Métis and Inuit youth across the country are really having high levels of mental health problems due to systemic oppressions, things like patriarchy, colonization, and many of our young people experience from a Western lens a lot of mental health disorders, such as feeling sad, having, sort of traumatic impacts, high levels of suicide that vary from community to community, self-harm, substance misuse. So that's kind of the reason, the background. But at the same time, from a clinical perspective, because I am a clinician as well as a researcher, I see that our young people who are having these issues are actually underusing and under accessing mental health services. Furthermore, the kind of the context to this is that the climate crisis is actually a global concern that young people find very problematic and carry around with them. And yet their voices are not really part of the decision-making process for what's going on in the natural environment, as well as with the mental health services that are supposed to be meeting their high levels of needs, despite the expected depth of negative impact on them. So basically, for First Nations, Métis and Inuit youth, there are also the added mental health disruptions from the climate crisis, which are beyond those impacting the general public, such as, increased colonial oppressions and threatened land-based cultural connections, which, as we know, are so vital to the identity, the wellness, and the resources for our young people. So, I mean, I think when we started to really delve into the literature on this topic, we found that there was a little bit written, but not a whole lot about how the climate crisis impacts Indigenous youth well-being. And what we really found was that, the burdens of harms created by the climate change and climate crisis has actually placed Indigenous youth in a very vulnerable position, because they actually hold the role of traditional caretakers and defenders of the land. And again, that idea of not having any say in what's going on with protecting or harming the land has made a huge impact on further reinforcing mental health challenges and difficulty with resiliency. So what were the objectives? So we consulted with Indigenous youth throughout all of our community partnerships. So we held talking circles with youth at Two Spirits of the First Nation. We consulted with service users at Native Women's Resource Center. We spoke to leaders of all of the organizations. We spoke to elders and came up with sort of 3 objectives based on what they told us was important to do in this work. And the first was really to establish successful solutions to youth mental health and wellness by transforming and changing the mental health care services through the use of Indigenous knowledges to reduce these sort of health inequities, to use the Western terminology for our young people. A second objective of the project is really to give youth the opportunity to provide recommendations to government on climate crisis and mental health policy change. And in the process, we really wanted to use Indigenous knowledges and Indigenous research methodologies that support community wellness through that process to improve mental health care and to educate providers and to inform policy. So what was the initial research question that we developed sort of in between the pre-pilot and the pilot, because the research questions have been sort of evolving. And this sounds very general, but what are the mental health impacts of climate change for Indigenous youth, and what services are needed to support young people? And there we have 3 generations of Clecho from my home when I visited. This was before the pandemic, so the kids are all older teenagers now, but this is the intergenerational piece that's so important to this project. So how did we answer this question in the pilot and the pre-pilot? Well, here's what we've done up to date, and that is we sought to sample a total of 500 people in a mixed methods design. So we aimed to have 400 respondents in a national survey, and that's currently in progress. And the survey, actually, we had initially aimed to have it out for kind of the months of March and April. I know it says March there, 2 weeks, but it was really March and April. But we're still trying to get more participants, so we've extended that to the end of this month. We also have done our group interviews with mental health workers through the Indigenous initiatives of Kids Help Phone. So mental health workers who are Indigenous and who work with Indigenous youth across the country. 12 youth in group interviews with Two Spirits of the First Nation, and youth interviews at Native Women's Resource Centre of Toronto. And then we also have the Knowledge Keepers, the interviews with them, which is actually still in progress. We were supposed to do it in the spring, but then we got busy, so we're just finishing those up right now. So I'm not going to read all of the survey questions to you, but I want to give you a little taste of what the survey questions. Community asked us to keep the survey short, but poignant. So we just asked questions, sort of holistic questions about the mental, the physical, the spiritual, and the emotional impacts of the climate crisis on youth, as well as sampling their level of knowledge about what the climate crisis entails and how it started and what its impacts are. So, so those were just some of the questions. I'm not going to read them out loud, actually. And if you know any Indigenous youth who want to take the survey, I can actually put the QR code for the survey. Shanti, we have that, right?
Yes, we do.
I can put that up on the screen, or we can also, is it possible to email that to all of the people who registered?
Yeah.
The link or the QR code?
We can probably send the link. Yeah.
Yeah, we can email the link, and I can also put it in the chat to the survey if anyone knows any Indigenous youth who'd like to fill out the survey before we close it next week. So the questions for the talking circle, the Indigenous talking circle that we did, which is sort of like an Indigenous way of doing a focus group. And how we do that is we have a research assistant, either from the team or from a community research assistant that comes to work on our team from our community partners, and an elder together facilitate in a ceremonial circle the discussions around these questions, such as, you know, how do you understand the climate crisis and how it developed? How does it affect your mental wellness? What is important about the climate crisis? How do you see Indigenous youth mental health in the future? What are some of your hopes, fears, and solutions for Indigenous mental health? And how do you see the climate crisis in the future, with some of your hopes, fears, and solutions for the climate crisis in terms of government policy, both locally and nationally? So these are what we call Indigenous narrative methodology that was adapted from work I did in the early 2000s, where we began to, I started with, you know, as a Western trained academic, because when I went to school, there was no Indigenous academics really. So I took Western tools of research, and I worked with community and elders to change those and use those from an Indigenous paradigm. So meaning spiritually grounded, culturally relevant and safe. So that's kind of how we developed this Indigenous narrative methodology, which I've published on extensively. So if you're interested, you could just Google Indigenous narrative methodology, and that really came on the work of Sylvia Barton, who was an Indigenous nursing academic. And I say honor her for initially developing this methodology. So in terms of the Indigenous talking circles with the mental health workers from the Kids Help Phone, we had, oh my goodness, I have the wrong slide in here. I'm so sorry. Let me find the right slide and I'll circle back to that. But I do have, this is an old slide. I do have the right slide. But let me move on to the talking circle, the youth talking circle findings. So we did the talking circles with the youth, and what their views on the mental health impacts of the climate crisis were really that culture, human wellness, climate justice, and environmental genocide were the most important things when they thought about the climate crisis and their mental health. And when they talked about their mental health, really, they talked about that their mental health was holistic and didn't just involve their physical health. It really focused on, or it didn't just involve their mind, but involved their overall physical well-being and their emotional experience of it. So the emotions were a lot of things, like if we were to put the codes in here underneath these meta themes and themes, they talked about feeling hopeless, about feeling depressed, about thinking, there was no future for them. They didn't want to have kids because they didn't see any point in having kids if there was going to be no natural environment. So there was a lot of very despondency around the emotional aspect of the climate crisis, as well as very strong views on the need for what they called climate justice. So things like addressing capitalism, colonialism through collective social resistance and individual social resistance, addressing social issues that linked into the climate through social actions, which are either collective or individual. Climate justice for dealing with what they called environmental genocide. So for them, this was really about pollution, damage to the natural environment, and the ongoing development of natural resources for human consumption. And then culture as that piece that was really talking about the critical aspect of being connected to the land, that their culture and their identity and their well-being was connected to relationships with the land, and the concept and practice, the Indigenous concept and cultural practice of reciprocity, both with each other as people and with the natural environment, with having traditional knowledges about ecology, about mental health as being very important and often missing, and as well as working from cultural values when addressing mental health and addressing the climate crisis. So that was sort of where we've been with this project. And, going forward from here, and I'm going to actually get the results from the workers talking circles to put in there. Sorry, I had the wrong slide in there. Is that so in the Northwest Territories site of the project, they're still doing their data collection and analysis. So they've been delayed. As you know, there have been fires there. That has shut down last year. Like most people in Yellowknife and other areas had to be evacuated to Alberta for months on end. So there was a lot of delays because of the actual climate crisis to this project. In Ontario, we are currently just completing data collection and analysis for that survey. We're not going to hit our target of 500, but we probably will have around 300. But maybe with some of all of yours help here, we can have a few more participants. And then what we really want to focus on over this fall and winter is, you know, sharing the results and the next levels of the research between the Northwest Territories site and the Ontario site, with bringing youth and elders together to share the information from the research, as well as to talk about going forward. And then, of course, to do a lot of other knowledge sharing. KT is just knowledge translation, that academic word, but it's really about sharing the knowledge of what we've learned from the youth and the elders in this project with everyone, so that we can begin to make these solutions. That includes policy briefs and reports for government, having, you know, community events to share the results. And really, we're inviting our youth and our young people and all of you guys who are listening to this to give feedback on these results and on how you think we should be sharing these results going forward. So we did just receive 5 years of funding from CAHR for a project grant, from now, starting November to October of 2029, to scale it to a national project. In the national project, we're going to do a national impact assessment of mental health for young people across the country. We're also going to work doing land-based mental health interventions and programs based on what the results of this pilot was. So what you said they needed for mental health and wellness, what the workers said, what the elders said, what the survey said. We will actually create programs of mental health supports based on what everyone said in this research. And those will be implemented and evaluated in multiple sites across the country, including here in Ontario, in northern BC, or sorry, in BC, in Alberta, and in the Northwest Territories. So that's sort of what our next steps are, as well as in the winter, we want to have a youth conference. And then in the spring, we also want to have an on the land event with the Northwest Territories near. And of course, everyone else is invited to that as well. So what I'd like to do before I continue on with the rest of the project would be, if I don't know, hang on, let me see if I can stop the share. So Shanti, are we able to do a group discussion here? Like, can we allow people to talk?
I can give folks a permission to speak, but currently it's just set to Q&A.
Oh, okay. Okay. So maybe, because, you know, I feel like the power of these types of things, even though they are online, is to have a discussion. It would be great if we could just pause from the presentation and have a short discussion with people. And we can't put breakout rooms in this, can we?
No, unfortunately, no.
Okay, so maybe next time we can do that, because I don't really know how all this stuff works, but I mean the technical stuff. But maybe, you know, I'd like to invite any people who are in the group, in the audience, to maybe give us some feedback about what you've heard, and anything that you think would be important going forward for sharing the knowledge that we have gathered so far. And if you want to maybe just put in the chat that you'd like to, how would people do that, Shanti? Raise a hand, or how do they ask to speak?
Yeah, so if they put in the chat that they would like to speak, then I can give them permission. So I'll give everybody a moment.
So yeah, please, I'd love to hear from everyone, because I feel like I'm just like, you know, talking at a machine when I can't hear back from people. And that's one thing I don't like about the way that Zoom sets this up.
And you've got a question in the Q&A there.
Mm-hmm. From Abigail from Iqaluit, and she's interested in sharing the QR code to community Facebook. Would that be all right? Is there a contact email that was if questions about the project? Yeah, definitely. That would be great to share it. So, Shanti, maybe you can email the
Yep.
QR code or the link, and then also the Ontario Near email address for questions.
Yeah, definitely. So I have posted both of the surveys in the chat, and we will also email them out after the webinar.
Great. So, how about any other like things that, because I'd love to actually get some kind of qualitative feedback from anyone in the audience about the project. We have quite a lot of people here, so love to hear from any of you.
Yep, so you've also got a question below there as well. Do you want me to read it out?
Okay, yeah, if you want to, that'd be great.
Yep, so it says, what advice would you give to students or professionals interested in pursuing a career in Indigenous health research and advocacy?
Advice?
Yes.
Students or professional? I feel like that's kind of a general question. I mean, I think, is there like a more specific aspect to that? Like, do you mean Indigenous students or professionals interested in pursuing a career in Indigenous health and research and advocacy, or non-Indigenous students and professionals? Maybe we could ask that person if they can go in the chat and we can give them a chance to speak so we can talk about that question.
They clarified, said Indigenous students and professionals.
Well, I mean, so there are a number of Indigenous health programs across Canada right now. So I think those are really great places to start, as well as, you know, connecting with Indigenous, you know, whether you're Indigenous or not. I think connecting with Indigenous faculty and community leaders, and, you know, working with them and for them can really help to, you know, ensure that you're doing work that's necessary and important and that you're connected to community. I mean, I guess the general advice for me would be, you know, everything that we do as an Indigenous people from an Indigenous knowledge's perspective is about being grounded in community and being driven by what community needs are. Because what's happened for the last, you know, 100 years or more that universities and colleges have been around is that much scholarship and research processes have been developed and implemented by non-Indigenous people for the benefit of non-Indigenous people. So, you know, whoever wants to do this work is great, but it really needs to be done at the direction and in the partnership of communities. So what does that mean in concrete terms? It means if you want to do a research project, or say you're a professional and you want to develop a program or help in some way, don't come into it thinking, well, you know, I know that this is what communities need. There's a high level of depression. I'm going to create a CBT for Indigenous youth. No, don't do that. Go to a community organization and ask them, hey, you know, I have skills or interest in mental health, or I'm a professional in mental health, or I'm a student in mental health. I'm interested in helping. What are some of the things that I can do to help with this? Either by programming, by research, by learning, by whatever. Does that answer your question? So I have to have my glasses on to see anything here. So Shanti,
Thank you.
okay, great. And
Yeah.
Shanti, do you want to read the other questions? That makes it easier for me to answer them, so that I'm not up in my head trying to read them.
Yeah, for sure. So the next question we have, it says, I think this work sounds amazing. I do research in Indigenous homelessness, houselessness that uses an expanded definition of homelessness that takes into account loss of connection to land. Have you heard this from people in your study so far? Have people talked about climate crisis and loss of home?
Oh, hang on, I got lost here. Yeah, absolutely. You know, housing and homelessness came up as part of the themes of around mental health. And I know, Shanti, you actually also worked, you know, you were one of the team members who worked on the analysis of the climate crisis meta themes and final data, which we haven't actually presented all here because we're not finished the final meta-analysis of all the data from this project. Because what I've shared here today is kind of the preliminary results from a few of the data sets. But Shanti, can you comment on that? Because you actually recently, you guys just did some of that work, right, on the team? Shanti, are you there?
Yeah. um, yeah, I mean, directly, yeah, I think, you know, that definitely has come up. Youth have for sure talked about this disconnection to land and, you know, being in a place like Toronto where there is so much, you know, concrete and a lack of access to nature. That's definitely been a theme in what we've seen from the feedback that youth have given us.
Yeah, and you know, what I think is really important about that is that, you know, when the young people talked about being homeless, what they were really talking about was not just the housing part, but the sort of like that spiritual and cultural connectedness to the land. And that's what young people really talked about as the piece that was connected to the climate crisis. Because even if people did have a home, or they had precarious housing, or they were sleeping in a shelter, or they were sleeping rough on the street, that idea of being not spiritually connected to the land, or the land being sick and not there for them in the way that they felt that it should be, or that it was for previous generations, caused a huge amount of depression and sadness that really just underpinned that sense of hopelessness. Does that answer the question? I see that there's, I'm sorry, just because of the lack of interaction on here, I find this a little bit challenging to not be able to.
There's a few more
hear
questions
what people are
in the
saying
Q&A.
back.
If you'd like for me to continue to read them
Yeah,
out.
please do.
And folks, if they raise their hands, then I can give them permission to speak, but they have to raise their hands.
Yes, I'd like people to speak. I'd rather speak to people than speak to a machine. But I'm enjoying speaking to you, Shanti, just to make that clear. But please raise your hands.
Okay, so we've got folks raising their hands. Just give me 1 second. All right, Ariana, you can go ahead.
Hi, Shanti. One of the questions that I had was in the slideshow, one of the meta themes was environmental genocide. I'm wondering if you could talk a bit more about that. Like, does that include actions like from the I don't know, the first thing that came to mind was like the RCMP and like the dog sled slaughters. Like, is that a form of environmental genocide? Or yeah, I don't know. I'm wondering if you could just talk more on that.
Shanti, do you want to talk? So Shanti is one of the research assistants, senior research assistants who work on this project with me, and she's doing the tech for this project right now. Shanti, did you want to answer that, or did you want me to answer it? Because I want to give you a chance to speak too, as you worked on the project.
It's okay, you can go ahead. I'm here managing the the tech.
Yeah. So the environmental genocide really was about like all the ways that, I mean, I think what you're talking about, that wasn't an example that was cited per se, but there were many examples cited by the youth of environmental genocide, like the pipeline, like Grassy Narrows, like things dating as far back as like to Oka. So it was like between political events, but also stuff like the ongoing, issue of like deforestation and tainted water, all those types of things that they knew about, greenhouse gases, like all of the ongoing things, as well as some of the larger, more high profile sort of public things and social actions for those crises that they were talking about. Does that answer your question?
Yeah, for sure.
I mean, just to
It-
add to that, youth knew a lot about these things, like more than I certainly know. And, they are keenly aware of this, and they carry it around as sort of like, it's kind of like always on the back burner, causing like anxiety or sadness. That was the sense I got from the young people that were interviewed. You're going to say something else?
No, that covered it. Yeah, it's a lot to think about because these environmental issues are so multidimensional. So yeah, they include like every level of at the macro and micro scale of like relationships, government relations, it's a lot to think about.
Yeah, and because our young people are the ones who are going to be carrying forward as caretakers of the land, as my generation starts to, die off, basically, them and their children, they're the ones who are responsible for all this genocide that has occurred in my generation, my parents' generation, my grandparents' generation. They feel a great burden of that, according to what was shared in this project. Anything else, Ariana?
No, I think that's good for me. I'd love to hear other people's thoughts. Oh, actually, yes, one more thing. Did they express in our time of social media and how much information they can like intake with just 20 minutes on their phone? Like, did they express a sense of hope with widespread information, or was it more anxiety inducing to be exposed to like 100 more issues once they look on
I
their
think the latter. I don't feel like anyone said anything about hope for that. Really. That wasn't that's not what I got out of any of the data. Shanti, did you get that sense that people felt like social media was hopeful for them in terms of, sharing information and doing things to, like what you're saying, Ariana, was to spread awareness?
No, unfortunately, I think it's kind of the opposite of that. I think the themes of, as you were mentioning previously, anxiety and sadness and depression, that's what mainly was coming up. And I think social media, in some ways, I think it can be very useful, but it has also alienated, folks from just being present and interacting with the land. So that's also something that we did see in the data. And we do have another participant who has raised their hand, so just 1 second. Hi, Kathy, you can go ahead.
Okay, yeah, I was just wondering, thanks for this really amazing and interesting information about this project. And I think it's just so, I don't know, it's really important. And I just have a question. I'm just wondering, because like I've read some stuff from Ingrid Waldron, who talks about environmental racism. I mean, she's talking about and how like the destruction of land and water, like more locally takes place, you know, close to Indigenous and other racialized communities. So I'm just wondering about your thoughts on like using that term environmental racism from an Indigenous perspective, because I know you talked about like, yeah, environmental genocide, which I think, because you are talking more broadly about climate crisis, but just wondering about your thoughts on environmental racism from an Indigenous perspective.
So sorry, I got kicked out of the room for some reason. My apologies. It just suddenly went away. So I'm back now. Shanti, did you want to answer that since I missed the first bit of the question?
Kathy was asking us to speak about environmental racism from an Indigenous perspective.
So environmental racism didn't come up per se, if I recall, and Shanti, you may want to correct me since you had your hands literally like hand coding all this data multiple times. I know you did. I don't recall environmental racism itself coming up as something that the youth specifically mentioned. But I think if we were to take the meta-analysis of all of this data and we're to be putting it into recommendations, which will be our next stage of knowledge translation around this, that I think environmental racism is definitely something that we would recommend that systems start to be aware of, that they are perpetuating, and that that's part of the problem. Because right now in Canada, there is a rise in anti-Indigenous racism specifically. And, you know, we're seeing that in the resurgence of, you know, the right-wing conservative sort of powers that have taking hold across the country and across North America and even across the world. And part of that is this rise in anti-Indigenous racism. And I see that having direct impacts for like the climate and mental health associated with the impacts of the climate on young people. I don't know if that makes sense. What do you think, Kathy?
Oh, can you hear me?
Yeah.
Yeah, no, I think that makes perfect sense, because I was thinking, because your project is bigger, it's about climate crisis, but I was thinking too, like it seems that a lot of, you know, like industry pipelines and things that disrupt the land and the water tend to be, you know, done in areas around where Indigenous people live, like where reserves are, or I mean, I know Ingrid Waldron, she talks more about like other racialized communities, but you know, it just seems like there is definitely, yeah, land close to Indigenous communities are definitely seem to be more vulnerable to destruction, and that has an impact, you know, more generally on the environment, I think. So, but yeah, I think that answers my question, my convoluted question, but.
Yeah, no, that was a great question, Kathy. It really was. And I think, you know, like, see, part of the issue with all of this, like, the kind of issues that underpin this, and then the implications for, you know, that this is really about, what did you call it? Environmental racism?
Yeah, environmental racism. So
You
yeah.
know, like the implications around that this is environmental racism and anti-Indigenous racism specifically are that, you know, there's a bigger systemic problem. Like all of these things, like Indigenous mental health problems, that's a systemic problem.
Yeah.
It's not an individual or biological issue. It's not
Yeah.
because there's something wrong with Indigenous people that they are having higher rates of mental health problems. It's because the system has set everything up so that we can only have mental health problems in the current environment and systems that we are being forced into by the laws and policies, including the laws and policies that allow the genocide of the natural environment, which we as Indigenous people rely on for our actual well-being.
Yeah.
Am I making sense?
Yes, no, that makes perfect that makes perfect sense. And I think that it is a systemic problem. And so environmental racism covers part of that, but not more of the systemic level of things, which is critical, right? Like to draw attention to that, because that's where, how else is real change going to happen other than,
Well, exactly. And real change is only going to happen when systemic changes happen. And that's why one really critical piece of this project is to take all of these, what the youth and the elders are saying and translate that into concrete recommendations that we can take to the government and be like, look, here's what our people are saying needs to be done. This is what has to be done. And we're not going to go away until you have listened to this and you have done something about this, because we are demanding that you listen to our young people and our knowledge keepers, because this is a matter of life and death, not just for our people, but for everyone. Because when the world shuts down out there, like the water stops flowing, the air stops being breathable, and we've had all this in increments, right? We've had it where we couldn't leave our house.
yeah,
We've had it when we couldn't drink the water. The air quality is so bad we can't go outside. Like when that happens to all people, then what?
Yeah.
This isn't just about us. It is about us and our actual survival, our young people's survival, but it's about everybody's survival. And that's one thing that I think needs to be heard, and that we need to demand that it's listened to, because otherwise I don't, it's not looking
It's not-
anything grim for the future.
yeah, it's not looking good. No, agreed. Very, yeah. Thank
All
you.
right.
Thank you.
I love you so much, Kathy. You're amazing. I miss you.
Thanks. This is really good. I'm just so excited by this project. It's amazing, really. So
Okay.
not that it's so grim, but that you're doing this.
Well, it's great working with the youth and elders. It's very exciting. So we have one other person who has their hand up, I think, and then after that we will Shaza.
Hi, yeah, so you can hear me, right?
Yeah.
Yeah, no, thank you. I'm really taken aback by this, just because I'm quite a novice in the area of mental health, and just a new space for me in my research. And I had put a comment in the Q&A just because I was always pushed towards these clinical scores, to be able to like, okay, no, you have to use this. You have to use this to measure anxiety, depression, and stress. Okay, for us to manage this. But I think one thing that I'm reflecting on and still continuing to reflect on is a word that you also describe in the way that you describe the results too as well, in the sense of that sense of burden that they had, which is, I think, is really hard to capture in a different way. And to me speaks to the love behind all this, that drives that burden. That's, at least that's the way I'm reading it, whereas I will never be able to read that from any other type of analysis. So I think I'm wondering if I am actually, like, that's a different way to look at, or is this something that's a different, am I reading it also right too as well, as that's something that is coming out too as well, that love aspect?
Yeah, no, I think absolutely you hit the nail on the head there. Is, like love, that's like one of our, cultural values and teachings, and that's love, and reciprocal relationships is part of the Indigenous determinants of health, as opposed to the social determinants of health, which are really a deficit model. When we look at what determines our people's well-being, love is one of the most important things. Having love in our lives, love for each other, ourselves, love for each other, love for the land, in a relationship that's based in respect, kindness, and reciprocity with each other and with the land and with the systems. And unfortunately, we have a lot of relationships with different systems that are not based on respect, kindness, or reciprocity. And certainly no love there, because we unfortunately right now we're living in a society that not only doesn't love its Indigenous people, it actually doesn't care about the basic human rights of Indigenous people. Because if our human rights were cared about by the system, we wouldn't be out today having to honor the Indian residential school survivors, because children would have never been put out to Christian rape camp schools in order to be assimilated out of their culture and into dominant culture. We wouldn't be dealing with the missing and murdered Indigenous women and girls crisis if the rights of Indigenous women and girls mattered to the systems of Canada. So we're kind of in like a bit of a conundrum here, where we have a clash of values between and ethics between Indigenous worldviews and Western worldviews that are what the Canadian laws and policies are. So until those are remediated, we're not going to see an end to these problems. Did that
Thank
answer
you
your
so much.
question a little bit?
Yes.
Maybe too
Yeah.
much?
No, it's the strength, again, it's that strength base versus the deficit look. It's key. Thank you.
Thank you. Thank you. So we're at the end of our time. Let me go back to my final slides then, if I can get there. Yeah. So just to kind of wrap it up, we did the questions or comments, and whoa, hang on, sorry here. If there's, I thought I had my my contact information on here, but maybe Shanti can put it in the chat. I thought my last slide was my contact information, but I can also put it in the chat for you. If anyone wants to talk to me, here's my email. You feel free to follow up. And the Shanti from the Ontario NEAR coordinator email address will send you all the link to the survey, as well as her email will be the one to respond to for questions regarding the survey. If you have broader questions about the research in general or anything else, you can feel free to email me at my email address there. I'd like to say Merci Cho to everyone for being here and engaging. And I would like to welcome our knowledge keeper back to give any closing comments before he closes our session.
Hi, everyone. Well, that was a really good session there, Ethsi. And I just want to thank our ancestors for coming in and making it a good meeting and stuff. And everybody had some really good questions and stuff. And hope everybody has good journeys on your trips home, and to all my relations. Bye, Mama P.
Mama P.
Matthew.
Aho, all my relations.
Oh, aho, all my relations.
So thank you, everyone. Have a wonderful afternoon. I hope to see you down in Nathan Phillips Square this afternoon. I'm going straight there from here. So much love to everyone. And thank you again for being here. Bye-bye.